All right, let's talk about how to activate our pelvic floor, our pelvis area, the muscles around our hips, where the replacement is, to try to just bring that awareness back into our body. I think for all of us who've gone through a hip replacement, our awareness becomes really different. We are super aware of pain and limitation, but we need to bring our awareness back into the body that we can manipulate and change a little bit and get stronger. So I just showed you how to activate the pelvic floor and open the hips in a very subtle and slight way on the back, on our floor, lying on the back. And I wanted to show you how you can do that in a chair if you're just not able to get up and down on the floor, which I get it. It's not pretty when I do get down, and it's really not pretty when I get up. So I'm going to sit on the very edge of my chair, bring my legs to neutral. I have a tendency, especially with hip pain, to bring my knees together. That does something in the space in my hips. I'm going to try to keep my knees apart in line with my hips, and then just bring my awareness to my pelvis, right around that pelvic bone, that pubic bone, and like the hip crease. You can feel where the thighs meet the pelvis, like right in that crease. And so when we're laying on our back, we pour the T, as I said. And I want you to think about a really long spine here. And it's not arched, it's not rounded, it's just long and lengthy. And then the tailbone, as I'm sitting, is straight down. So to do a pelvic tilt in a seated position, I'm going to tuck the tail under. Okay, so now I've poured the T in. And then to reverse that, I'm going to rock my pelvis forward and my tail's going to shoot to the back behind me. So tuck the pelvis under, bring the tail through, and then bring the tail back. So take just a few of those. You can even bring your hands onto your hips and feel how the pelvis can move. Now, having a background in yoga and helping people for 2 decades with back pain, the thing that I've learned the most is that our pelvis needs to have mobility. When we sit in a chair a lot, whether we're recovering or that's just the way that we are, our pelvis gets very, very stuck, which can cause some back pain. So just doing that, I can feel the release in my low back, and I can feel the under part of my belly really start to activate, and that's what we want. So let's go to the next thing that I showed you on the floor. Is just that open and close. Okay, so we're just letting the hips externally rotate and then come back. So just starting to bring a little awareness to the cheeks. I notice my right leg is my unaffected leg. It wants to go all over the place. It has lots of mobility and range of motion. The left one is very limited. So it takes me really concentrating and even using my hand to get that left leg to want to do what I want it to do. And that's because it's been guarded and protected for way too long. So we're going to get this one going again. Okay, so we did that also on the back. And now we're going to do those very famous heel slides. We've all done them in PT, but basically, dig your heel into the floor, slide it out, slide it in. Now, the reason why this is so good is because it activates the hamstrings. As you bring it in, activates the hip flexor. It's activating the quadricep as you pull in. And now, if you really want to take the mind into the body, push into the heel and feel the hamstrings lengthen. Feel the stretch. And now squeeze the quad, squeeze the bun, and bring it back in. Now, the slower you go, the more you're going to feel this. So, we all have a tendency to rush through the exercises because it's like, okay, I did it, check the box. But when we're looking at activating our body back into where we want it to be, fitness wise, flexibility, mobility, strength, whatever your vision of after this hip replacement where you want to be, focusing on doing things slow and deliberate is going to help you activate those muscles in a way better than just moving really fast. And when we take that philosophy and we apply it to our life, if we are eating, we're going to enjoy the food so much better if we do it slow and mindful. If we're in a conversation and we're listening and we're thinking before we speak, we're going to have a much better conversation than if we're just all over the place, scattered and interrupting and blah, blah, blah. So, not only does this intention to be mindful in our rehab help us build strength back in our body that we want desperately, but it also teaches us how to do something that's maybe uncomfortable in a way that's mindful and we're in control. We're in intention. Okay, so pelvic tucks activate the core. Activate the adductors and the abductors, the glute muscles, by opening and closing, and then activating hamstrings, quads, and hip flexors by moving through those heel slides really slow. Now, we can't do a bridge in a seated position like we did on the floor, so that's the only one that's not accessible in a chair. But those three exercises, just as part one, to start getting activation back into your body, to be thinking about not just your affected leg, but your unaffected leg, heel slides, bringing awareness. Okay, so it's really easy for me to do heel slides with this leg. It's really hard for me to do heel slides with this leg. So I acknowledge it and I work a little harder with my affected leg. So stay tuned for part two, and we're going to do some standing work with the same mindset of activating awareness and intention. And then we move to some seated work that has to do with balance. And then we close it up with some integrated stretching. So I hope you stick around for the series. I think it's a great way to come back to the basics of what we learned in physical therapy, what we learned in our very initial rehab, whether you're brand new or you maybe need to come back, or maybe you're a year and a half out like me and just never really healed. And you want to kind of come back to the basics and build strength and start from there with a good foundation. So I'll see you in part two. Take care.